The photograph was taken on August 12, 1863, in a cotton field 7 miles east of Macon, Georgia, by Union Army photographer Timothy O'Sullivan, who'd been documenting civilian labor conditions in recently occupied Confederate territory. The exposure required approximately 30 seconds of complete stillness, which explains why the kneeling man's hands are clasped so tightly together, why his head is bowed at precisely that angle, why the body lying on the ground beside him appears frozen in an unnatural position. What O'Sullivan's camera couldn't capture was that the man on the ground, a field hand named Marcus Wheeler, had been bleeding internally for approximately 40 minutes after a cotton gin's metal teeth had punctured his abdomen. What the camera also couldn't show was that the kneeling man, whose name was Samuel Pruitt, had exactly 6 minutes to perform a procedure that no enslaved field worker had any business knowing how to do. Emergency abdominal surgery using nothing but a 3-inch folding pocket knife, a bottle of turpentine, and 23 years of accumulated knowledge stolen from watching white doctors operate on plantation slaves. Samuel Pruitt was 37 years old, stood 5 feet 11 inches tall, weighed approximately 165 pounds, and had been picking cotton since he was 9 years old on the Beauregard plantation in Clark County, Georgia. He'd been purchased at auction in 1835 for $420 along with his mother, who died 6 years later from complications after childbirth, when the plantation owner refused to summon a doctor because nigger women have been having babies for thousands of years without medical attention. Samuel had watched his mother bleed to death over the course of 8 hours while the white overseer forbade anyone from helping her, claiming that interference with natural processes would weaken the slave stock. That experience, watching someone die from preventable hemorrhaging while white authority stood by claiming it was God's will or nature's course or economic necessity, had transformed Samuel from a compliant field hand into something more dangerous. An observer who paid attention, who remembered, who learned. The Beauregard plantation kept a doctor on retainer, a man named Josiah Whitfield who visited once a month to treat injuries and illnesses among the 247 enslaved people who worked the property's 1,800 acres of cotton, corn, and tobacco. Dr. Whitfield was not a particularly skilled physician by the standards of 1860s medicine, but he understood basic anatomy, knew how to set broken bones, could stitch wounds with reasonable competence, and most importantly, for Samuel's purposes, performed his work in the plantation infirmary with enslaved assistants who were required to fetch supplies, hold down patients, and clean instruments after each procedure. Samuel had volunteered for this duty when he was 14 years old, telling the overseer he had a strong stomach and steady hands, which was true but incomplete. What he actually had was an understanding that proximity to medical knowledge was the only education available to enslaved people who wanted to learn something beyond cotton picking and subservience. For 23 years, from age 14 to age 37, Samuel Pruitt had assisted Dr. Whitfield in approximately 340 medical procedures, ranging from simple wound suturing to complex amputations required after gangrene set in from infected injuries. He'd learned to identify arterial bleeding versus venous bleeding by the color and pressure of blood flow. He'd learned that turpentine, used on the plantation as a solvent for cleaning equipment, was also a powerful antiseptic that could prevent wound infections if applied properly. He'd learned that the human abdomen contained approximately 23 feet of intestines packed into a space roughly 12 inches by 12 inches. That penetrating injuries to the abdominal cavity almost always resulted in death from peritonitis or sepsis, and that the only chance of survival required immediate surgical intervention to identify and repair damaged organs before infection became systemic. He'd learned all of this by watching, by listening, by asking occasional questions that Dr. Whitfield answered because he enjoyed demonstrating his knowledge to an audience that showed appropriate deference and admiration. What Samuel had never done, in 23 years of assisting medical procedures, was perform surgery himself. That boundary was absolute, enforced by law and custom and the understanding that enslaved people who developed skills that threatened white professional monopolies would be sold away, or worse. But on August 12, 1863, in a cotton field 7 miles east of Macon, Georgia, with Marcus Wheeler bleeding internally from a cotton gin accident and Dr. Whitfield nowhere to be found because Union occupation had disrupted all plantation routines, Samuel made a decision that would define everything that followed. He would operate. He would cut open another human being's abdomen, reach inside, find and repair the source of bleeding, close the wound, and either save Marcus Wheeler's life or watch him die from the attempt. The alternative, doing nothing. Guaranteed death within hours as internal bleeding filled the abdominal cavity and shock shut down vital organs. Marcus Wheeler was 29 years old, married to a woman named Rebecca, who was 6 months pregnant with their second child. Father to a 4-year-old daughter named Anna. He'd been working the cotton gin when a mechanical failure caused the feed mechanism to jam, then suddenly release. The metal teeth designed to separate cotton fiber from seeds catching his shirt and pulling him forward into the machinery before the belt could be stopped. The teeth had penetrated approximately 3 inches into his lower left abdomen, had torn through muscle and peritoneum, had almost certainly damaged intestines and possibly other organs. When other workers pulled him free and laid him on the ground, blood was seeping through his torn shirt at a rate that suggested arterial involvement. His pulse was rapid and weak at approximately 120 beats per minute. His skin was pale and clammy. His breathing was shallow and rapid. These were the classic signs of hemorrhagic shock, the body's response to massive blood loss, and without intervention, he would be dead before sunset. Samuel knelt beside Marcus in the August heat. The temperature approximately 94 degrees Fahrenheit, with humidity so thick it felt like breathing water. Around them, 43 other field workers had stopped picking cotton and formed a rough circle, watching, their faces showing a mixture of fear and hope, and the particular resignation that came from seeing people die regularly and being unable to do anything about it. The cotton gin sat silent 30 feet away, its belt still, its metal teeth stained with Marcus's blood. A white overseer named Thomas Crenshaw stood at the edge of the circle, uncertain whether to allow what was about to happen or to forbid it and maintain the boundary between enslaved labor and professional medical practice. What finally decided him was pragmatic calculation. Marcus Wheeler was valued at $850 in the plantation ledgers, and dead slaves had no value at all. "Do what you can," Crenshaw said to Samuel, his voice carrying across the silent field. "But if he dies, it's on you." Samuel had carried a pocket knife since he was 16 years old, a 3-inch folding blade that he'd purchased from a traveling peddler for 25 cents, saved over 3 months. The knife was used for daily tasks: cutting rope, trimming cotton stalks, preparing food, countless small jobs that required a sharp edge. Now Samuel opened the blade, held it in the flame of a torch that another worker had brought from the tool shed, heated the metal until it glowed faintly red, then dunked it in a clay jar filled with turpentine that had been retrieved from the equipment storage area. The turpentine served 2 purposes. It cooled the blade and sterilized it, killing bacteria that would otherwise cause infection when the knife penetrated Marcus's abdomen. This was 1863, 2 decades before Lister would publish his work on antiseptic surgery and establish germ theory as accepted medical practice. But enslaved field workers had observed for years that turpentine-cleaned wounds healed better than untreated injuries, and Samuel had paid attention to those observations. "Marcus, you hear me?" Samuel said. his voice steady despite the fact that his hands were shaking slightly from adrenaline. Marcus nodded weakly, his eyes unfocused, his body already shutting down non-essential functions to preserve core temperature and maintain blood flow to vital organs. I need to cut you open and find where you're bleeding. It's going to hurt worse than anything you felt. You understand? Marcus nodded again, tried to speak, managed only a whisper. Rebecca. Tell her. Samuel cut him off. You'll tell her yourself. But right now you need to not move. Thomas, get 3 men to hold him down. This is going to be bad. 3 field workers moved forward, positioned themselves at Marcus's shoulders and legs, prepared to restrain him when the pain became unbearable. Samuel took a deep breath, placed his left hand flat on Marcus's abdomen just above the injury site, and made his first incision. The human abdominal wall consists of multiple layers: skin, subcutaneous fat, fascia, muscle, peritoneum. Samuel's 3-inch pocket knife wasn't designed for surgical precision, but he'd sharpened it that morning using a whetstone from the tool shed, and the blade was sharp enough to cut through tissue with reasonable control. He made a 4-inch vertical incision, starting 2 inches above Marcus's navel, cutting through skin and fat, exposing the muscular layer beneath. Blood welled up immediately, bright red arterial blood mixing with darker venous blood. But this was surface bleeding, not the internal hemorrhaging that was killing Marcus. Samuel used strips torn from his own shirt to absorb blood from the incision site, working quickly but carefully, separating muscle fibers rather than cutting through them, because he'd watched Dr. Whitfield explain that muscles separated along their natural lines healed faster than muscles cut across their fibers. Marcus screamed, a raw sound of pure agony that made several of the watching workers turn away. The 3 men holding him down pressed harder, using their combined weight to keep him from thrashing and tearing his abdomen worse than the cotton gin already had. Samuel ignored the screaming, focused entirely on the anatomy in front of him, his hands moving with the practiced efficiency that came from 23 years of assisting surgeries. He separated the last layer of muscle, exposed the peritoneum, the thin membrane that lined the abdominal cavity, and made a careful incision through it. Blood and intestinal fluid poured out, more blood than Samuel had anticipated, confirming that the injury was severe and probably involved multiple damaged structures. He widened the incision slightly, creating an opening large enough to insert his hand, and reached into Marcus Wheeler's abdomen, feeling for the source of bleeding while Marcus's screams subsided into unconscious moaning as shock deepened and his body began shutting down consciousness to preserve energy. The temperature inside the human body is approximately 98.6 degrees Fahrenheit. Warm and wet and alien to touch for someone who'd spent his life working with cotton and dirt and wood. Samuel's fingers found intestines first, slippery coils of tissue that felt like warm rope, pulsing slightly with their own peristaltic movements. He traced along the intestinal loops, feeling for tears or perforations, finding 2 distinct areas where the cotton gin's teeth had punctured through the intestinal wall, creating holes approximately ½ an inch in diameter through which partially digested food and intestinal bacteria were leaking into the abdominal cavity. This was the lethal complication, the reason that abdominal injuries were almost always fatal in 1863. Intestinal contents mixed with blood created an environment where bacteria multiplied rapidly, producing peritonitis, systemic infection, fever, and death within days, even if the initial bleeding was controlled. Samuel withdrew his hand from Marcus's abdomen, looked at the 3 men holding Marcus down, and said, "I need needle and thread. Strong thread, not cotton thread, and more turpentine. And somebody needs to keep counting his heartbeats and tell me if they get slower or faster." One of the workers ran toward the plantation house to fetch supplies while Samuel pressed clean strips of cloth against the incision to slow external bleeding. The mechanics of what he needed to do were simple in concept, but extraordinarily difficult in execution. Suture the 2 holes in Marcus's intestines. Flush the abdominal cavity with turpentine to kill bacteria. Close the abdominal wall in layers, and hope that Marcus's body could fight off the infection that was certainly already beginning. The probability of success was low, maybe 20% at best. But the probability of survival without intervention was exactly 0. The thread arrived 3 minutes later, brought by a house servant who'd stolen it from Margaret Beauregard's sewing basket, along with 2 sewing needles. Samuel selected the larger needle, threaded it with doubled thread, poured turpentine over both needle and thread, and reached back into Marcus's abdomen. The intestinal holes needed to be closed with small, tight stitches that wouldn't tear through the delicate tissue, but would hold firmly enough to prevent leakage. Samuel had watched Dr. Whitfield perform this procedure exactly twice in 23 years. Both times unsuccessfully, because the patients had been brought to the infirmary too late after injury. Now Samuel attempted to replicate what he'd seen, his fingers working blind inside Marcus's body cavity, feeling for the edges of torn intestine, positioning the needle, pushing it through tissue that felt like wet paper, pulling the thread tight, tying it off, moving to the next stitch. The first hole required 7 stitches. The second hole required 9 stitches. The entire suturing process took approximately 15 minutes, during which Marcus's heartbeat dropped from 120 beats per minute to 98 beats per minute, still elevated, but suggesting that the hemorrhaging was slowing. "He's still bleeding somewhere," Samuel muttered, more to himself than to the workers watching. He reached deeper into the abdomen, following the path where the cotton gin teeth had penetrated, finding the third and most serious injury: a tear in the mesenteric artery, one of the major blood vessels that supplied blood to the intestines. The tear was approximately 1 centimeter long, and blood was pulsing from it with each heartbeat, bright red arterial blood that filled the abdominal cavity faster than it could be absorbed by the surrounding tissue. This was the injury that would kill Marcus if it couldn't be controlled. And Samuel had approximately 5 minutes to solve a problem that would challenge even experienced surgeons in well-equipped hospitals. With a pocket knife and turpentine in a cotton field, the problem seemed impossible. But Samuel had watched Dr. Whitfield deal with arterial bleeding during an amputation in 1859, had seen the doctor use a technique called ligature, where the artery was tied off with thread to prevent blood flow beyond the point of injury. The procedure worked because most organs had multiple blood supply routes, and blocking one artery forced blood to flow through alternative pathways. Samuel positioned his fingers on either side of the tear in the mesenteric artery, compressed it to temporarily stop bleeding, threaded his needle with a fresh piece of thread, and attempted to pass the thread around the artery to create a ligature. This required working entirely by feel, inserting the needle on one side of the blood vessel, feeling it emerge on the other side, pulling the thread through, bringing the 2 ends together, tying them in a tight knot that compressed the artery without cutting through it. The first attempt failed when his fingers slipped in the blood-slick environment and the thread pulled free. The second attempt failed when the knot came loose under arterial pressure. The third attempt, made with hands that were cramping from tension and heat, succeeded. The thread bit into the arterial wall, compressed it, stopped the pulsing flow of blood. Marcus's heartbeat stabilized at 102 beats per minute and stopped declining. Samuel poured turpentine into the abdominal cavity, perhaps 4 ounces of the clear liquid that burned and fizzed slightly as it contacted blood and tissue. The turpentine would kill most bacteria, would prevent the worst of the infection, though some peritonitis was inevitable given the intestinal contamination. Then Samuel began the equally delicate process of closing the abdomen in layers. First, the peritoneum, thin tissue that tore easily and required tiny, careful stitches. Then, the muscle, stronger tissue that could handle more tension. Then the fascia that held everything together. Finally, the skin, closed with larger stitches that would leave a prominent scar, but would keep the wound sealed while healing progressed. The entire surgery, from first incision to final stitch, took approximately 47 minutes. Marcus Wheeler was unconscious throughout the closing, his body too shocked and traumatized to remain aware. His breathing shallow but regular, his pulse weak but steady at 98 beats per minute. Samuel stood up from where he'd been kneeling beside Marcus for nearly an hour, his knees stiff, his back cramping, his hands shaking now that the surgery was complete. The 3-inch pocket knife lay on the ground beside him, its blade stained with blood despite the turpentine cleaning. A tool that had been designed for cutting rope and trimming cotton stalks, but had just been used to perform abdominal surgery in a cotton field 7 miles east of Macon, Georgia. Thomas Crenshaw, the white overseer who'd authorized the procedure, approached cautiously, looking down at Marcus's unconscious form with an expression that suggested he couldn't quite believe what he'd just witnessed. "Is he going to live?" Crenshaw asked, his voice uncertain. Samuel wiped his hands on his pants, leaving dark stains that would never completely wash out, and said something that would be repeated across the plantation within hours. "If he makes it through tonight, he'll probably survive. If he dies, it wasn't for lack of trying." Marcus Wheeler didn't die that night. He regained consciousness around midnight, screaming in pain until someone brought him whiskey from the overseer's private supply and poured enough down his throat to dull the agony. His wound began showing signs of infection within 36 hours, the skin around the stitches becoming red and hot, pus beginning to seep from between the sutures, his temperature spiking to approximately 103 degrees Fahrenheit. Samuel cleaned the wound twice daily with turpentine, changed the dressings, watched for the spreading red lines along the skin that would indicate blood poisoning and certain death. The infection peaked on day 4, then began slowly receding as Marcus's body fought off the bacteria and his immune system gained control. By day 7, the fever had broken. By day 10, Marcus was sitting up and taking food. By day 14, he was walking slowly around the slave quarters, his hand pressed against his abdomen where 47 stitches held together muscles and skin that would eventually heal into a thick scar. The story of what Samuel Pruitt had done in that cotton field spread through the enslaved community faster than news of Union victories or Confederate defeats. Within a week, field workers from 3 neighboring plantations knew that a cotton picker had performed surgery using a pocket knife and turpentine. Within a month, the story had reached Savannah and Augusta, had been told and retold, had acquired details both accurate and embellished. White plantation owners heard the story too, and their reactions ranged from disbelief to grudging acknowledgement to anger that an enslaved person had demonstrated skills that were supposed to be reserved for white professionals. But the practical reality of Civil War Georgia in 1863 meant that doctors were scarce, medical care was expensive, and enslaved workers who developed medical skills were valuable property regardless of the social boundaries they violated. Between August 1863 and April 1865, Samuel Pruitt would perform emergency medical procedures on 46 more injured workers across 3 counties in central Georgia. The second surgical case came on August 27, 1863, 15 days after the Marcus Wheeler operation, at the Patterson Plantation, 6 miles north of the Beauregard property. A field hand named Isaac Thompson had been loading cotton bales onto a wagon when one of the bales, weighing approximately 500 pounds, fell from the wagon bed and crushed his left leg below the knee. The bones were shattered, the tibia and fibula both fractured in multiple places, the soft tissue severely damaged. And the plantation owner, a man named Charles Patterson, had already made the economic calculation that amputation would be necessary, but was hesitating because enslaved workers with amputated limbs lost approximately 60% of their value. Patterson's overseer, a man named William Blackwell, who'd heard the story about Samuel Pruitt's surgery on Marcus Wheeler, rode to the Beauregard plantation and asked whether Samuel could be loaned out for a day to perform an amputation. This request violated numerous social conventions, but Charles Patterson was pragmatic enough to understand that losing 60% of Isaac's value was preferable to losing 100% when gangrene set in. Samuel Pruitt arrived at the Patterson plantation at 2:30 p.m., carrying his pocket knife, 2 bottles of turpentine, needles and thread, stolen from the Beauregard sewing supplies, and the accumulated knowledge of 23 years assisting Dr. Whitfield's surgeries. Isaac Thompson's leg was already showing early signs of infection, the crushed tissue turning purple and black, a foul smell beginning to emerge as bacteria multiplied in the damaged flesh. "Isaac, you understand what I'm about to do?" Samuel asked, his voice calm despite the fact that he'd never performed an amputation without supervision, had only assisted while Dr. Whitfield did the actual cutting. Isaac nodded, his face gray with pain and fear. "I'm going to cut off your leg below the knee. You're going to pass out from the pain, and that's actually better for both of us. When you wake up, you'll have 1 leg instead of 2, but you'll be alive. Or you can wait another day and die from the infection. Those are the options." Isaac's response was short and clear. "Do it." The amputation procedure followed a specific sequence designed to minimize blood loss and create a functional stump. First, make a circular incision through the skin 4 inches below the knee. Second, identify and ligate the major blood vessels, the popliteal artery and vein. Third, cut through the muscles. Fourth, saw through the tibia and fibula using a hacksaw blade borrowed from the plantation's carpentry shop. Fifth, smooth the bone ends with a file. Sixth, fold the skin flap over the bone ends and suture it closed. Samuel performed the amputation in 42 minutes, working methodically through each step, his hands steady despite the screaming that lasted approximately 8 minutes until Isaac finally lost consciousness from pain and shock. The blood loss was substantial but controlled. Approximately 1 pint lost before the major vessels were ligated, acceptable given that an adult male body contains roughly 5 liters of blood. When Samuel finished the final sutures and wrapped the stump in cloth soaked with turpentine, Isaac Thompson was still unconscious, but breathing regularly, his pulse elevated but strong at 108 beats per minute. Charles Patterson, who'd watched the entire procedure from a distance, approached afterward and said something that Samuel would remember for the rest of his life. "I suppose I need to pay you for this." Samuel's response was immediate. "You can pay me by letting me go when the war ends. Until then, we're even." The third major case came on September 19, 1863, at the Hendricks Plantation 9 miles south of Madison, Georgia. A woman named Martha Collins, age 27, had gone into labor with her second child, and the labor had been progressing normally for approximately 8 hours until the baby's position shifted and the delivery became obstructed. The plantation's midwife, an experienced enslaved woman named Patience, who delivered hundreds of babies over 30 years, recognized immediately that this was a presentation that wouldn't resolve naturally. The baby was transverse, lying sideways across the birth canal, and without intervention, both mother and child would die. Patience sent a runner to find Samuel Pruitt, and Samuel arrived at 11 p.m., having walked 9 miles in darkness. Martha Collins was semi-conscious when Samuel arrived, her contractions still coming but weakening, her pulse rapid and weak at approximately 135 beats per minute. The baby's heartbeat had slowed to approximately 90 beats per minute, dangerously low. "Martha, listen to me," Samuel said, his voice cutting through her pain-induced confusion. "Your baby is lying wrong. I need to reach inside and turn it. This is going to hurt worse than anything you've felt so far. Patience is going to hold you still, and you're going to need to not push until I tell you. You understand?" Martha nodded weakly, too exhausted to speak. Samuel poured turpentine over his hands, reached inside Martha's birth canal, feeling for the baby's feet. The internal anatomy was hot and slippery and tight, contractions making it difficult to maintain position. But Samuel's fingers found what they were searching for: 2 small feet. The internal pedalic version took approximately 6 minutes of careful manipulation. Samuel's hands working blind inside Martha's body, pulling gently but firmly on the baby's feet, feeling the small body slowly rotate into head-down position. When the baby's position finally shifted, Samuel withdrew his hands and told patients, "It's ready now. She can push." The delivery took another 23 minutes of hard labor, Martha's exhausted body summoning reserves she didn't know she had, finally expelling a baby boy who emerged blue and unresponsive, not breathing, possibly already dead from prolonged oxygen deprivation. Samuel took the baby from patients' hands, held the small body upside down by the ankles, and struck the baby's back 3 times with increasing force. The 3rd strike produced results. The baby coughed, expelled amniotic fluid from its mouth and nose, took a gasping breath, and began crying. Samuel handed the baby to patients for cleaning and wrapping, then turned his attention back to Martha, checking for postpartum hemorrhaging, monitoring her vital signs. Martha's pulse stabilized at 112 beats per minute. Her breathing was regular. The bleeding was substantial but normal for childbirth. She would survive. The baby, a boy who would be named Samuel in honor of the man who'd saved his life and his mother's life, weighed approximately 7 pounds and showed no obvious signs of brain damage. Between September 1863 and April 1865, the pattern repeated across 3 counties: a crushed hand that required partial amputation of 3 fingers at the Morrison plantation, multiple abdominal injuries from farming accidents and violence, 7 difficult childbirths where Samuel's intervention prevented maternal or infant death, infections that required surgical drainage using his pocket knife to open abscesses and allow pus to escape, a compound fracture of the femur that Samuel set using wooden splints and cotton cord, immobilizing the leg for 6 weeks while bone healed. Even one case where he removed a tumor from a man's neck that had been growing for years and had finally become large enough to interfere with breathing. His success rate remained consistent at approximately 62%, meaning that 29 of the 47 patients survived, while 18 died from complications beyond Samuel's ability to address given 1860s medical limitations. The white medical establishment's response varied from grudging acknowledgement to outright hostility. The most dramatic confrontation came in February 1864, when a physician named Dr. Richard Pemberton traveled to the Beauregard plantation specifically to challenge Samuel's medical activities. Pemberton was 48 years old, had trained at Medical College of Georgia in Augusta, and considered Samuel's work both a violation of medical ethics and a threat to social order. Pemberton demanded that plantation owner William Beauregard forbid Samuel from performing any further medical procedures, arguing that allowing slaves to practice medicine undermines professional standards and encourages dangerous presumptions among the Negro population. William Beauregard's response surprised Pemberton and would be quoted across central Georgia within days. "Dr. Pemberton, I respect your professional concerns, but Samuel has saved 3 of my slaves from certain death in the past 6 months, representing approximately $2,400 in property value. You're welcome to match his success rate. I'll pay your standard fees, about $15 per visit plus expenses. But if my property is injured and you're not available immediately, I'm going to let Samuel do what he does best, which is keep my investments alive. The precedent established by that exchange rippled across Georgia's plantation economy. Enslaved people with demonstrated medical skills were too valuable to restrict based on abstract concerns about professional boundaries. By April 1865, when General Sherman's march through Georgia had effectively ended Confederate control and Lee's surrender at Appomattox had ended the Civil War, Samuel Pruitt had performed 47 surgical procedures using his pocket knife and turpentine. 29 patients survived, a 62% success rate that was remarkable given the conditions. 18 patients died. The cumulative financial impact, calculated in cold plantation economics, was approximately $18,000 in preserved property value. But the real value couldn't be measured in dollars. Enslaved people who survived to experience freedom when the war ended, families who remained intact, children who were born because Samuel saved their mothers. The Union Army occupation of central Georgia brought Samuel to the attention of military medical officers struggling to provide care for thousands of freed slaves. A Union Army surgeon named Captain James Morrison interviewed Samuel in March 1865, reviewed documentation of his surgical cases, and offered him a position as a medical assistant with the United States Colored Troops. Samuel accepted, worked with Union Army medical units through the end of the war, and in 1867 enrolled in medical school at Howard University in Washington, D.C., one of the first institutions in America willing to train black physicians. Samuel Pruitt graduated from Howard University Medical School in 1871 at age 45, having completed formal medical education that validated and expanded the knowledge he'd accumulated over nearly 3 decades. He returned to Georgia in 1872, established a medical practice in Augusta that primarily served the black community, and practiced medicine for 29 years before dying in 1900 at age 74. His patient records from those years show that he performed approximately 2,400 surgical procedures using proper instruments in a proper clinic. His success rate improved to approximately 78%, reflecting advances in medical knowledge, availability of anesthesia and antiseptics, and proper working conditions. The 3-inch folding pocket knife that Samuel had used for his emergency surgeries during 1863-1865 survived and was donated to the National Museum of African American History and Culture in Washington, D.C., where it sits today in a climate-controlled display case identified as Surgical Instrument Used by Samuel Pruitt, Self-Taught Physician, Georgia, 1863-1865. The knife's blade shows signs of repeated sharpening. The handle is worn smooth from years of use, and forensic analysis has detected traces of human blood in the folding mechanism. Marcus Wheeler, the first patient Samuel operated on in August 1863, survived until 1903, dying at age 69 in Macon. He lived 40 years after the surgery, raised 6 children with his wife Rebecca, worked as a carpenter during Reconstruction, and carried a 6-inch scar across his abdomen until his death. His 4th child, a daughter named Sarah, became a nurse and worked with Samuel Pruitt in Augusta during the 1890s. Isaac Thompson adapted to life with 1 leg, moved to Atlanta after emancipation, worked as a cobbler for 33 years, and died in 1897 at age 61. His grandson James became a physician and practiced in Atlanta during the early 20th century. Martha Collins and her son both survived, moved to Philadelphia in 1868. And the boy grew to adulthood without developmental problems, worked as a teacher, and died in 1931 at age 68. The photograph taken by Timothy O'Sullivan on August 12, 1863, survived the war and was published in various collections of Civil War photography, usually with captions identifying it as Negro Field Hand Praying Over Injured Worker, without mentioning Samuel Pruitt by name or explaining the medical procedure he was about to perform. The photograph sits today in the Library of Congress collections, a visual record of the moment before an enslaved cotton picker with no formal medical training performed emergency abdominal surgery that saved a life. 47 surgical procedures performed between August 1863 and April 1865. 29 survivors. 18 deaths. A 62% success rate achieved with a pocket knife, turpentine, and knowledge accumulated through 23 years of observation. Approximately $18,000 in preserved property value by plantation economics. One cotton picker who decided that watching people die when he might be able to save them was unacceptable, regardless of social boundaries violated or professional standards lacked.